Welcome to my channel. Heart disease. Causes of a heart attack. Heart disease refers to conditions that involve the heart, its vessels, muscles, valves, or internal electric pathways responsible for muscular contraction. Common heart disease conditions include coronary artery disease, heart failure, cardiomyopathy, heart valve disease, arrhythmias. Coronary artery disease is the main cause of heart attacks. It is the most common kind of heart disease in the U.S. Heart attack symptoms. The following are warning signs of a heart attack. Chest pain may spread to the back, neck, arms and/or jaw. Dizziness, nausea, vomiting, rapid or irregular heartbeats, shortness of breath. Some people may exhibit anxiety, indigestion and/or heartburn. Some women may present with these as their predominant symptoms instead of chest pain. Weakness, lightheadedness, breaking out in a cold sweat. Women may experience different heart attack signs and symptoms than men. Jaw pain, shortness of breath, and nausea and vomiting may be more common in women who have heart attacks than men. Heart attack symptoms in women. Although some women present with symptoms of chest pain, a large number of women will not present with chest pain. Instead, women commonly have a different set of heart attack symptoms. Know these heart attack symptoms: arrhythmias, cough, heartburn, loss of appetite, malaise. Such symptoms in women cause delays in diagnosis if the symptoms are not considered as possible signs of heart disease. Delays in diagnosis can cause further damage to heart tissue or even death. Women should exercise, quit smoking, start exercising, and see their doctors for regular checkups to monitor heart disease risk factors. Heart failure. Heart failure, also termed congestive heart failure, means the pumping action of the heart cannot meet the body's demand for blood. It does not mean that the heart fails to pump, it does mean a failure in an aspect of the heart's ability to complete an otherwise normal function. The symptoms and signs are almost identical to those seen with cardiomyopathy. Most cases of heart failure are chronic, long-term heart failure. Who is at risk for heart disease? Health conditions, lifestyle, age, and family history may increase your risk for heart disease. Although men, even at a younger age, have a higher risk for heart disease than women, heart disease is still the #1 killer of both sexes, about 611,000 total deaths per year. Approximately 735,000 people in the U.S. suffer a heart attack every year. People with a family history of heart disease, who smoke, and who are obese have a higher risk of developing heart disease. About half of all Americans, 47%, have at least one of 3 key risk factors for heart disease, including high blood pressure, high cholesterol, or smoking. Approximately 80 million people in the U.S. have some form of heart disease. It is the leading cause of death in men and women in the U.S. Smoking increases heart disease risk. Many researchers suggest one of the best things a person can do to decrease the risk of heart disease is to stop smoking cigarettes. Smoking increases a person's risk for heart disease from 2 to about 4 times greater than non-smokers. Smoking can damage the heart muscle, its blood vessels, can raise blood pressure, increase carbon monoxide levels, and reduce oxygen available to heart tissue. People who do not smoke but are exposed to secondhand smoke are at greater risk for heart disease than those not exposed to secondhand smoke. Although over 135,000 people die each year from heart disease related to smoking, it is never too late to quit smoking, because once you quit, your risk of heart disease begins to drop almost immediately. According to the American Heart Association, there are 480,000 deaths due to smoking-related illnesses in the U.S. every year. Thanks for watching. Subscribe for more videos.